Hi, I am Dr. Chandrodaya. I am consultant pediatric surgeon in Madhukar Rainbow Children Hospital. So today we are going to discuss about a difference between hernia and hydrocele. These are very common problem related to scrotum which we see in our children in daily life. So if any of your children is having scrotal swelling, when you will describe that it is hernia or hydrocele. In case of hernia, both are not a surgical emergency, but still we have to take care of that when we should consider for any advice with the surgical team or when we consult a doctor. So in case of hernia, we'll see there is a swelling in the inguinal region in the groin and which is going to the scrotum. So in case of hernia, that once the children cries or cough or when we strain, these swelling get increased, and once the children stop crying or if we lie that on the bed in the supine position, these swelling reduces spontaneously without pressing it or without any physical activity. So this is called hernia. In case of hydrocele, these swelling doesn't reduce once if we lie down the baby or if we press it. So it is hydrocele. So in case of hernia, we should consult with the doctor that when we should go for the surgery. It's not a सर्जिकल इमरजेंसी, बट स्टिल देयर इज सम इम्पॉर्टेंट रिस्क जिसमें कि हम कह सकते हैं कि नहीं, बच्चे को अगर वो स्वेलिंग वापस से रिड्यूस नहीं हो रही है तो उस कंडीशन में कब हम उसको सर्जिकल इमरजेंसी कहेंगे. अगर बच्चे को उल्टी हो रही है, बहुत ज़्यादा दर्द हो रहा है या फिर स्वेलिंग के ऊपर रेडनेस अगर हमें दिख रही है, इन दैट केस वी शुड कंसल्ट डॉक्टर इमीडिएटली बिकॉज दैट इज सर्जिकल इमरजेंसी. सो इफ वी सी ऑल दिस सिम्टम्स वी शुड कंसल्ट आवर डॉक्टर इमीडिएटली इन केस ऑफ hernia. But in case of hydrocele, no any such surgical emergency is there, so we should consult, but there is no surgical emergency in that case. So please take care of that. Thank you.